So first, Kelley, I'm going to turn over to you. And as you said, I think Connor's story is a little bit out there, so we don't have to focus on that for that long. But can you give us sort of a breakdown of Connor's life, diagnosis, finding your way collectively to n-Lorem?
Sure. Is my mic on?
Can you hear? Yeah.
Yes, okay. My son, Connor, just turned 15 in June, and he started presenting with symptoms really a few days after birth, and he was my second son, so I knew what a healthy baby should be like.
Yeah.
But wasn't sleeping, wasn't feeding, started having seizures at 8 months old, and seizures meaning dozens a day, and trialing every single available anti-epileptic drug, and nothing was really reducing them. A lot of developmental delay, irritability, agitation, wasn't meeting milestones. And it was a matter of really going from doctor to doctor, institution to institution, trying to figure out what was wrong with my son. And when he was almost 5 years old is when he was diagnosed with a mutation in the SCN2A gene. And very little was known about the gene at that time, and there were no available treatments. And
so can I stop you? So
yeah.
Because I do know a little bit about this, I did my reading to prepare, but it was something like 33 potential diagnoses had been handed to you, none of which were correct.
None was the root diagnosis of the 2A gene mutation,
right,
correct?
It might be this and okay, and it might be this, but no one quite knew yet. And I think that honestly, Connor was on something like 15 drugs at one time trying to contain the epilepsy, right?
The epilepsy and
the
all
seizures.
of the other symptoms.
Yeah, okay, so 5 years, and also this is 5 years of, I don't know, did you, were you focused on this full time? Were you able to have a job? I assume this sort of took over your life.
It absolutely took over our life and our entire family's life. I was a high school English teacher before I had Connor, and then he required all of my care. And then I started working in a job to learn more and do research studies into SCN2A gene mutations after he was diagnosed.
Okay, so what did that look like? What does that mean?
That looked like trying to raise money and fund research projects for researchers and clinicians and scientists to study the SCN2A gene in the hopes of finding some sort of treatment for my son.
You start a foundation, basically.
Different research projects. Mm-hmm.
Yeah, right, okay. So that's at 5. That's still a long way to go to where we are today. Mm-hmm. So what happens after that?
So Connor was not a candidate for any of the different pharmaceuticals that came out for SCN2A mutations, different trials, because of the unique properties of his specific SCN2A mutation.
Which were what?
He has a combination of gain and loss of function in his specific mutation.
Okay, so where does that leave you at that point?
That left me completely devastated, having nowhere to turn, not knowing where to go to help my son. And I had met Stan several different times over the years, and I saw him speak at the TIDES conference in about 2018, and I went up to say hello at one of the breaks, and he let me know that he had the idea at the time of a foundation to help N of 1 patients where they had no other treatment. And right away I was completely excited. I was like, that could help my son, and started emailing him immediately on, here's all the info on Connor's mutation, could this possibly help? What do you think?
So you had met Stan because you were attending conferences doing research for Connor. And you just went up to say hi because you'd met him before, but you didn't know, you knew about ASOs, in other words, but you didn't think that it was possible to have an ASO for something as specific as this.
No, Stan was working at Ionis at the time.
Yeah, okay. So he says, I've got this idea. I might be leaving Ionis and starting a foundation. You said, can I submit, or what happens?
Yeah, as soon as applications became available, we were the very first patient to submit and apply.
How did you meet Olivia?
I met Olivia because my son's institution, where he is seen for primary neurology, is Brady Children's Hospital, and Dr. Gleason, who's the chief scientific officer now of n-Lorem, introduced us.
And so what year was this?
This was a couple of years ago.
Yeah, I want maybe 2021.
So after you had started with n-Lorem. Okay, so you put this application in. How long does that take to get some sort of response from n-Lorem?
Well,
or did it take?
I knew some of the people that were working with n-Lorem right away because it was being set up as I was already interacting. So I think our application process might have taken a little longer than patients nowadays because things were getting set up as I was applying.
Yeah. So even though you know that Stan is going to put this foundation together, you don't know if they're going to be able to create an ASO that can help. When did you learn that that might be a possibility?
Maybe a couple years into it.
Did Stan call you at home? What happened?
I was in constant contact with Stan, getting updates every few months about the progress, and so yes, I was kept up to speed with every single milestone that happened.
And then they said, okay, we think we can create this ASO. We want to set up a trial for Connor.
Mm-hmm.
Yeah. And do you know anything about how that worked with the FDA? Because this would have been really early. Olivia, you're nodding. Yeah.
Yeah. Well, this was when the appropriate ASO was selected, and then it was submitted to the FDA, I want to say a little over a year ago. And then the IND was approved last summer, and then we started with the current protocol, and it's gone through some revisions, but we started dosing this year.
Okay. Mm-hmm. Do you want to talk about that?
Sure. We started our first dose in March, and we are 6 months in after 4 doses, intrathecally delivered. And the initial dosing was first month 30 days apart, and then 2 months apart, and we've had a couple of subsequent doses at 3 months interval with dose escalation.
Yeah. And so this is different from Ryan. This is not sub-Q, and it's kind of a more involved process. You had to prepare Connor for that, I suppose. How did you do that?
Connor's 15, and he has autism and movement disorder and developmental delays and seizures, as Kelley has mentioned. And so the most mundane procedures you would think, like getting a blood pressure, is a challenge in and of itself. And so putting a trial together in a protocol format for implementation in a research setting is, you have to be mindful of what patients are going to go through and what the steps are to make it least burdensome for patients, and also be able to kind of monitor the right outcome measures. And so that was very important in bringing that together, and at the same time, developing that and then getting institutional support to move forward with that as well. But we bundle a lot of the diagnostic studies, outcome measures into one day, so that we can have a sedated procedure, so that there's little traumatic effect to Connor, because it's just getting literally vital signs can be challenging, and so as like a regular lab draw is not so easy, and so these things are very important to think about in terms of trial design in an N of 1, unique to the patient.
So can you sort of take me through what the first day looks like for that first dose? Connor comes in, has to be sedated, the injection's given, he's monitored for how long?
So he had some labs leading up to it, and he has intrathecal delivery in the operating room under sedation, and so there's some labs that are done and vital monitoring before we go in, and then he gets dosed in the morning, and once he's coming out of sedation, we'll put on his EEG leads, do his EKG, and then he's monitored on overnight, and then goes home, and he's getting some measures in the interim as well.
Okay. Kelley, can you tell me about responses that you've seen in Connor or changes?
Yes. So I also want to just back up too and touch on his first dose.
Yeah.
So as I mentioned, he turned 15 in June, and this has been years of really nothing available for my son, right?
15.
Except the hope of what n-Lorem represents, right, in ASO. And it was a very long process, and I just want to touch on the day of dosing was literally one of the most exciting events that I've ever experienced in my son's life. And when he came out of the dosing, out of anesthesia, and he was in the recovery room, and he was still asleep, and he had EEG leads on his head, it was like such a moment. And I'm not really that emotional of a person, but I had tears in my eyes.
Yeah.
Olivia and I shared a moment, and it was like, we did it. Like, we all did it. Like, and Laura, Olivia, there was so much that went into that. So that right there was just such a huge accomplishment for a child that had nothing else, no other chance.
But this is even before you know that it's going to work or not. It's just the fact that you have sort of climbed this mountain to where something is finally available to at least try.
And this ASO was in him, right? Yeah. And now let's see what it's going to do.
Right.
Mm-hmm. Right.
I remember that exact moment because he hadn't even woken up from sedation yet, and so we were just in the post-op recovery area, and you specifically had said that it was like one of the first times he'd been in the hospital with an EEG on and Connor sedated, but it was for not something negative necessarily, and so that's what was very different in being in that situation. And so we do have that on video too, so I'll show you guys at some point.
I mean, it would be a terrible ending if it didn't actually benefit Connor, but I know that it has, so let's talk about that.
And I don't know that would be a terrible ending because...
Well, it wouldn't be an ending, but it would be, to reach this high of like it's in him, and if it didn't actually work, we have to do it again, right? So,
Because I think it's so important that the fact that you even have an N of 1 designed for a single patient who literally is just seen clinically as well, and then to deliver that on an investigational level, it's just that in and of itself is a feat regardless. So I think, because you can see how hard it is to implement anywhere. And so I think that's why Kelley says that as well.
So he comes out, and what happens over the first month or two?
Well, I want to talk about expectations also, right? So like Stan touched on is certain endpoints, right? So what is going to shift his quality of life? So ours were a reduction in seizures that we were hoping to see, and a reduction in his movement disorder. He has a very, very severe movement disorder that prevents him from doing a lot of things unassisted, non-ambulatory, so has never walked in his life, and nonverbal. We have a lot of other scales that we're using also as exploratory endpoints. And after the second dose, so 3 weeks after the second dose, his seizures stopped. His seizures stopped, and he started taking steps unassisted for the very first time in his entire life, and he's 15 years old.
So I think if I'm remembering this, it's amazing, right? To put the seizures in context, I think it was something like 30 a day?
So that was in the first early years of his life, the first few years. So he averages about 1 to 4 seizures, tonic seizures a day.
As an adult, or as a teenager,
for the last couple of years.
And so that dropped?
Correct.
And he began to walk?
He began to take steps unassisted. So he got up to about 50 steps all by himself. And he has never taken steps by himself before.
I mean, amazing. Olivia, do you want to add anything to that?
Yeah, that was incredible and not really something that we were expecting. And it was a persistent and consistent thing that we were seeing after dosing week to week. And as we had Stan touched on earlier, in that even that was like low dosing, very low initial dosing. With the FDA, we had like a certain trajectory of dose escalation, and even that, because of his specific variant, we were increasing dosing more slowly, and even there, we were seeing that change. And so it was very interesting to see and unexpected, and it was also interesting that as the dose interval kind of continued and the symptoms, his ability to walk kind of wore off. And so that was very interesting to learn about ASO effect.
Yeah.
Right. Okay. So that was after the second dose, you said?
3 weeks after.
So have you seen continued improvement since then, or is there a plateauing that you've experienced?
It's not necessarily a plateau. It's what Stan touched on in his introduction, right? So all of these are novel gene targets, right? Almost unique programs. And so it's figuring out, my son is a true pioneer. We're learning about the SCN2A gene mutation from Connor being dosed with this ASO. And we've had to dose increase very slowly. Ion channels are very sensitive. And we've had to go even slower based on what the FDA recommended his dose to be, slower than what the original protocol was designed. And so the current dose level the effect does not last 3 months in between doses. So for example, his last dose was in August. 3 weeks after his dose in August, his seizures stopped. He started walking again, and just this past Saturday, his seizures came back. So the effect has lasted about 2 months. And really about the last week, he's not taking steps very well by himself anymore. So it's just a matter of the next dosing period, we're going up again. We're increasing the dose. So it's just Connor's going to tell us, does going up in dose now last the full 3 months, or what do we need to change? It's just, I guess it's constantly learning from the molecule through Connor on what the next step is.
There's no thought, I mean, I know that this is a trial, but keeping the dose level the same, but just increasing the frequency?
We could, right? But also what is possible the higher we go, right? So
right.
I mean, there's always that discussion about, because ASOs have long half-lives that are months long, and so we want to see, we're already scheduled to dose escalate in a couple of weeks here, and so we're very still low dose, I would say, at this point, so there's both options to increase dosing and change intervals. But
and so are there any, because this is a trial, like the same question for Ryan, sort of like, how long is the trial meant to be? Is there a point where you would have more freedom to do something outside of the rigors of a trial? I don't know.
It's under clinicaltrials.gov, so it's a formal trial, and it's a 2-year study at this point, and it's we have currently it's every 3 months, but there's ongoing feedback with the FDA. So I mean, we're just continuing to engage with updates, and I think we could make amendments to it depending on what we see.
As you mentioned, like, Connor's the pioneer patient, the way Ryan is because he's an older patient, and also because Susanna. What has been learned about the ASOs that might be applicable to others with an SCN2A mutation?
Well, one thing in this journey, I've had a lot of feedback from different clinicians, even scientists saying my son is too old to receive any kind of benefit at his current age. So we've learned that that's not true, which has been huge, right?
Yeah.
That I'm sure if we treated him much younger, thousands of seizures ago, right, the response could have potentially been greater, but he is certainly having a response even at 15 years of age.
Yeah. Olivia.
SCN2A is a channelopathy, an ion channel that mediates communication between brain cells, and so there's many different variants, and you can't just non-specifically apply one ASO, but in Connor's specific case, he's not a candidate, as you mentioned, for some commercially coming down the pipeline ASOs for SCN2A, which can help other variants. So this is where it's important to recognize also the genotype-phenotype heterogeneity of single gene mutations and how one may not necessarily be applicable, and that even within the space there's a specific need for N of one or N of few for the rare variants, and that's a constant question that comes up as a pediatric neurologist and epileptologist, is where is the limits of reversibility or intervention? You know, it's a developmental epileptic encephalopathy. It starts early onset, can be first day of life or months in, but the symptoms persist years and years going forward, and so there is no reason to say that there's no opportunity to intervene on a developmental level. We don't know that, and so we're seeing changes.
Kelley, can you talk about maybe the difference in your family before and after starting a treatment?
Yes. Well, I mean, we've been excited about this in my family. I have 3 kids total, so Connor has 2 other brothers, a younger brother and an older brother. We've been talking about this ASO for years in my household and very excited about the prospect of it. I'd say the most inspirational moments have been the times that Connor started walking on his own with his brothers, myself, his dad, his stepdad, my parents. It was like brothers and sisters, friends. It was, like I said, that's not what we were expecting, and it was the most exciting thing ever to witness and watch. So I'd say just like some of our happiest moments along this journey have been since we've had the ASO dose. I'd also say going over a month without watching Connor have a seizure, that in of itself is massive. Not having to watch him suffer through that and not having to deal with it or come in the way of our daily plans, or having to watch him have a seizure before he falls asleep at night. Like, no matter how many times you see that as a parent, it's devastating. It never gets easier. So I'd say, some of those things. And then just also, we're at a very low dose. We've already seen incredible changes, and I don't think we've seen the full extent of the capabilities of this or potential of this ASO yet. So just really excited at what's to come next, especially when we dial in the ideal dose and frequency of dosing.
So I know he does communicate with you, yeah? He's able to.
He can type on a letterboard with assistance, yes.
Right. Has he said anything about it? Like going to the hospital, how he feels before and after doses?
I mean, he's been really excited also. Like Connor, understands everything cognitively, and oftentimes he's able to type. So he was very excited for the ASO, and he's the first one, before we really saw anything clinically, he's the first one that typed with his letterboard that his brain feels calm. And that right there, and then we saw the decrease in seizures, and then we saw the improvement in the movement disorder. And he also is the first to type that his brain doesn't feel calm anymore, or the ASO is wearing off, or so he's able to communicate certain things that he's feeling. He also was so thrilled that he's taking steps and proud of himself, but now he's typing that he wants to talk, right? That's his next goal.
I'm sure you've explained sort of that, like the value that he has as being a pioneer patient. Does he have any thoughts on that?
I tell him all the time. I mean, I've been telling Connor that for years, because he, in addition to n-Lorem, he's helped a lot of other patients with different things that I've constantly tell him that his life has huge impact and great deep meaning. So he's well aware of that.
Yeah. Anything else that you'd like to, we talked earlier, that anything else you'd like to add that I probably haven't asked?
What do you think?
I think that you've been a great parent advocate through this whole process as well, because it's not easy to be a parent of a child going through an investigational study that's with a lot of eyes on you as well. And so I think it's a big journey, and it's a very important relationship to have with your whole team of research team. But we're very interested to see what comes next.
Well, then I also have to comment the same is true as Olivia. Honestly, to have a physician in this, something like so novel and pioneering, that's right there fighting every step of the way, that believes in this and is willing to try something brand new, because certainly not every physician is. So it's a great team. We're a great duo.
So.
Yeah.
I mean, can I just, why do you think you are that way? Like, how did you, so when you bring this to families, like, hey, we don't really know what's going on, but there's this thing we can try. It's risky. It's never been put in a human being before. How do you explain that?
For me, my clinical context is that almost everybody I see has intractable epilepsy, like uncontrolled seizures, and many of those children and babies are going to have a genetic etiology, whether it's diagnosed or not, and need some sort of intervention that's not standard, whether it's surgery or diet therapies or more novel therapies like this. And so it's the process of going through that diagnosis and delivering that for families, and then going through the process of what comes next and what's in the future. This is something that comes up naturally as part of the diagnosis and next steps. And I think, I'm always hopeful with caution, because you want to see what's available, but always keeping your eyes on the horizon for new therapies.
Yeah. We have about 2 minutes left, and I do have one left, but does anybody have any question they'd like to ask either one of these panelists? Yeah.
Uh-oh, Stan?
Stan has a question.
Hi guys, Jeff Carroll. In this context, I'm a rare disease family member, and I think it's incredible what Connor and n-Lorem have done together, but I hope both of you can take at least just a minute to let it break through what you guys have done as a physician, as a mom, and just really amazing and incredible inspirational story. So I hope you get to feel good at least a little bit at the time.
Thanks, Jeff.
Stan.
Don't grill us, Stan.
I'm going to. Why don't we talk about Connor's GI problems?
Oh, yeah.
And what that's done to his life, and what you're seeing in response to the ASO. And then, Amy, can we show a video?
Yes.
I'm tired of words. Let's see Connor walk. Okay.
Sure. So
6 words.
Yep, there's a lot of talk about seizures, for example, as a symptom of the SCN2A mutation, but GI has been one of the most difficult symptoms to help manage for Connor, really since birth.
That's very common of a lot of channelopathies as well, I would say.
Right, and so everything revolved around GI. We've tried all the available pharmaceuticals, nothing has really helped. And I'm keeping a GI diary, and I have to do a scale, and so he has severe constipation issues, and after dosing, about 3 weeks after, there's about a month where I'm not having to administer any type of suppository or enema whatsoever, and he's having normal bowel movement. So that's been huge in our household.
Yeah, again, not the top of your list, but huge, right? Yeah.
Huge for quality of life.
Yeah. Yeah.
Yeah. And
Do
that's-
we have a video?
And that's really important because we think that's autonomic. That's a type of central nervous system. And this is the first time we've ever been able to demonstrate in a human being that I'm aware of that an ASO can have an effect in that particular part of the brain. And I think this is going undiagnosed in so many patients that there are autonomic dysfunctions that are just being ignored because they're not convenient to think about in this syndrome. So it's, I think it really matters. And the reason I started n-Lorem was Connor and another boy. Both of them are being treated and both of them are getting a lot better. And I don't know how you can ask for more than that.
Yeah.
So,